Phantom limb pain is a challenging condition that affects many individuals after amputation. It refers to pain or discomfort felt in a limb that is no longer present. This phenomenon is surprisingly common, with estimates suggesting that up to 80% of amputees may experience it at some point. The pain can range from mild to severe and often impacts daily activities, emotional well-being, and overall quality of life. Understanding the mechanisms behind phantom limb pain is crucial for developing effective prevention strategies. Both peripheral and central nervous system changes contribute to this condition, making it a complex issue to address. In this video, we'll explore the latest preventive approaches that can help reduce the risk and severity of phantom limb pain after lower limb amputation. Preventing phantom limb pain is essential because current treatments often provide only limited relief. Once phantom pain develops, it can be persistent and difficult to manage, leading to ongoing discomfort and a significant treatment burden. This not only affects physical health but also contributes to anxiety, depression, and reduced participation in rehabilitation. By focusing on prevention, healthcare providers aim to improve the quality of life for amputees and minimize the long-term impact of this condition. Recent research highlights the importance of early intervention and a proactive approach, as these can significantly reduce the incidence and severity of phantom limb pain. Recent systematic review analyzed strategies for preventing phantom limb pain in lower limb amputees. Researchers conducted a comprehensive search across 4 major databases, identifying nearly 1,800 articles published over the last decade. Only human studies focusing on preventive or prophylactic treatments were included, with a preference for randomized controlled trials and cohort studies. The quality of each study was carefully assessed using established tools like the Cochrane Risk of Bias and the Newcastle-Ottawa Scale. This rigorous approach ensured that only the most reliable evidence was considered, providing a solid foundation for the recommendations discussed in this video. Unpromising approach to preventing phantom limb pain involves surgical techniques during amputation. A notable study compared traditional neurectomy with a combination of peripheral nerve coaptation, collagen nerve wrapping, and submuscular transposition. The results were striking. Patients who received the combined surgical intervention had significantly lower rates of phantom limb pain at both 2 and 6 months after surgery. These methods help protect nerves, reduce scar formation, and prevent painful neuroma development. By addressing nerve health during the initial surgery, surgeons can greatly reduce the risk of chronic pain for amputees. Mirror therapy is a non-pharmacological technique that has shown great promise in preventing phantom limb pain. In this method, patients perform movements with their intact limb while watching its reflection in a mirror, creating the illusion that both limbs are present and moving. This visual feedback helps rewire the brain's sensory and motor pathways, reducing pain signals associated with the missing limb. Clinical trials have demonstrated that regular mirror therapy sessions can significantly lower both the incidence and intensity of phantom limb pain. It's a simple, cost-effective intervention that can be easily incorporated into rehabilitation programs for amputees. Several medications have been studied for their preventive effects on phantom limb pain. Dexmedetomidine, when used as an epidural infusion before and after surgery, has been shown to lower the incidence of phantom pain compared to traditional opioids like fentanyl. Similarly, adding calcitonin to epidural anesthesia can significantly reduce the severity of phantom pain over time. Gabapentin, an oral medication commonly used for neuropathic pain, has also demonstrated effectiveness in lowering phantom limb pain rates, especially in pediatric patients. These pharmacological options offer valuable tools for clinicians aiming to prevent chronic pain after amputation. Each preventive method targets different aspects of the pain pathway. Surgical techniques focus on protecting nerves and minimizing scar tissue, which can otherwise lead to painful neuromas. Medications like dexmedetomidine and gabapentin modulate neurotransmitter release and reduce nerve excitability, lowering the risk of pain signals becoming chronic. Mirror therapy, on the other hand, helps retrain the brain's response to sensory input, reducing the mismatch between expected and actual limb feedback. By combining these approaches, healthcare providers can address both the physical and neurological contributors to phantom limb pain. While the studies reviewed provide encouraging results, it's important to note some limitations. Most of the research involved small sample sizes and some were pilot studies. This means that while the findings are promising, larger and more diverse studies are needed to confirm the effectiveness of these preventive strategies. Quality assessments using tools like the Cochrane Risk of Bias and the Newcastle-Ottawa Scale help ensure reliability, but ongoing research is essential. As the field advances, these preventive methods may become standard practice, offering hope for better outcomes in amputee care. Preventing phantom limb pain is a crucial step in improving the lives of amputees. By integrating surgical and non-surgical strategies, clinicians can significantly reduce the risk and severity of this challenging condition. Early intervention, personalized care, and ongoing research will continue to shape the future of amputation management. Ultimately, these advances aim to restore function, enhance rehabilitation, and support the emotional well-being of those living with limb loss. As more evidence emerges, the hope is that phantom limb pain will become a manageable, and perhaps even preventable, complication for future generations.